Hello, I am Janice Dunsavage, a member of ISMP's Board of Directors. Today, I'm joining you from work on the front lines at UPMC Pinnacle in Harrisburg, Pennsylvania. Obviously, masks and scrubs are a little bit different than we normally dress for the Cheers Awards. On behalf of the ISMP and ECRI leadership teams, thank you for attending our first virtual Cheers Awards ceremony. We're so glad that you can join us and your colleagues from around the world to celebrate our winners. Everyone keeps hearing that these are unprecedented times and we're in this together. With that in mind, we are so grateful for your support of ISMP so that we can continue to help the entire healthcare community make medication use safer, even with the challenges we are all facing. Despite the challenges, ISMP staff continue to do what we do, although in new ways, some even better. I would like to take a minute to recognize several staff members who have worked around the clock to put together this first virtual Cheers Awards ceremony. They are Renee Brio, Jennifer Gold, Jordan Rufo, and Lisa Shiroff. They have helped us adapt to the challenges posed by the pandemic to create a truly amazing event. Lisa, Jordan, Renee, and Jennifer, thank you so much for your creativity to pull this together. Although we will all miss interacting in person, of course, our safety is paramount. Most of ISMP staff will be available in our virtual booth tonight during our networking time. We hope that you will stop to connect with us and hear about some of our plans for the future. Also, please visit our website and follow us on social media to stay connected in the future. So, until we meet again, please stay safe and know that ISMP is still here in full force. We hope you have a wonderful evening building bridges to safety. Best wishes for a safe and productive new year.
Hi, everyone, and good evening. I'm Mike Cohen, ISMP President, and welcome to our 23rd Annual Cheers Awards. We're honored to have you join us for our first virtual awards ceremony. Yeah, we've never done this before. Tonight's going to be dedicated to recognizing healthcare organizations and leaders who've shown incredible commitment to advancing medication safety. Although we sure wish we could see all of you in person, holding the ISMP Cheers Awards online this year makes sure that we can all stay safe. And speaking of staying safe, as I am sure you know, the CDC just recently changed their recommendations to advocate for mask wearing indoors when not at home. Now, I'm attending the Cheers tonight in the nearly empty ISMP offices in our conference room with just a few staff members who are socially distanced. But you know what? I'm going to keep my mask on anyway, just to be extra safe. So our theme this year for Cheers is building bridges to safety. I'm sure you've seen that. The idea of bridges spanning gaps and providing a path forward over obstacles seems especially relevant given recent events. We faced unexpected challenges in healthcare this year with the COVID-19 pandemic, like having to pronounce bamlanivimab. How was that? I did pretty well, I think. And learning what an emergency use authorization is. Still, by working together, we're finding solutions and ways to continue advancing medication safety. I'd like to stress that ISMP couldn't do it without you, all of our loyal supporters. When you submit our reports to us or give us feedback on our recommendations, when you read and incorporate the advice in our newsletters, make changes to your products, or make a donation, you are helping us achieve our common safety goals, and we greatly appreciate it. And I'm so proud of the way that we've come together as a community to get us through the surges, address rapidly changing practice environments, and find the best way forward. You were there when we needed help with information on infusion pumps in the hallway. I thought they were crazy when I first heard about that, but it was needed, and it was something that we learned to support. Or, due to drug shortages, having to contend with neuromuscular blocker caps without the usual vial cap warning, paralyzing agent. Believe me, people, your willingness to help benefited many thousands of health professionals and probably millions of the patients that they serve. Now I'd like to share a few highlights of what ISMP has accomplished with your help this year alone. For example, we released special free editions of the ISMP newsletter a week apart, several of them, and they were devoted to the information healthcare practitioners need for COVID-19 related response efforts, from what to keep in mind when placing infusion pumps in the hallway, as I was saying, to avoiding a culture of blame during pandemic nursing. As I mentioned earlier, we alerted professionals about neuromuscular blocking agents entering the market without usual warnings on their caps, and also the introduction of a propofol product with double the concentration of what is typically available in the United States. And I can't tell you how much we appreciated working with FDA and with the industry folks to get this information out there so people were prepared for it. And we're still helping to get information like that out there, obviously. We also launched this past year the 2021 Targeted Medication Safety Best Practices for Hospitals, with new items addressing opioids and automated dispensing cabinet overrides. We also issued revised and expanded guidelines for the safe use of smart infusion pumps to maximize intended safety benefits and better position organizations for bidirectional interoperability with the electronic health record. Great technology. We published the results of ISMP surveys on sterile compounding, both inside and outside the pharmacy, that revealed gaps and challenges. And we also received a contract from FDA to develop and conduct a perioperative medication safety self-assessment to address medication use from the time a patient is prepared for a procedure in the OR until he or she is discharged home. Sent out a national alert called the National Alert Network, or NAN, warning about dangerous wrong route errors with tranexamic acid. And as a result of the advocacy, it was just announced last week that FDA is requiring changes to the product labeling for that product, for tranexamic acid, to prevent future errors, some of which were fatal, by the way, and they happen all over the world. But we're protecting patients in the United States with this recent change. Hope the other countries do the same. ISMP is dedicated to helping keep you and your patients safe, especially during the pandemic. And I have to say, just for a minute, what our nurses and doctors and pharmacists out there on the front lines and other health professionals have done, it's hard for me not to get emotional when I think about it or see it on television, holding hands and hugging patients that can't be with their family. It's heartbreaking to see this, and I don't know how they do it, but unbelievable. I'm sure everyone listening tonight knows what I'm talking about and is as thankful as I am expressing now. Well, over our long history, we've collaborated with many different organizations and groups in pursuit of our mission to prevent errors and save lives. One of those groups is ECRI. ISMP became an ECRI affiliate earlier this year by joining together, and we have created one of the largest healthcare quality and safety entities in the world. I would now like to hand over to Dr. Marcus Schabacher of ECRI, the CEO of ECRI, and also our board chair, the ISMP board chair, so he can also welcome you to tonight's Cheers Awards ceremony and talk about our new partnership's impact on patient safety and where the field of healthcare may be headed in the future. Marcus?
23rd Annual Cheers Award, honoring individual and organizational medication safety achievement. First of all, congratulations to this year's winners. And allow me to echo Mike's comments about our frontline workers. As a former practicing physician, I can truly understand what these folks are going through. And I want to thank them from the bottom of my heart for all the hard work, the empathy, the passion, and the compassion they bring at these incredible, difficult times. So thank you to all of you. I'm the president and CEO of ECRI, an independent, nonprofit organization whose mission is to advance effective, evidence-based healthcare globally. For more than 50 years, the people of ECRI have been unyielding in their work to protect patients from unsafe and ineffective medical technologies and practices. ECRI focuses on independently evaluating medical technology, providing clinical evidence assurance, and ensuring patient safety across all care settings. And we couldn't be happier that ISMP is now an affiliate of ours. Much work is needed to keep patients safe. Preventable medical errors are the third leading cause of death, as you might well know. And 30% of those deaths are due to medication errors. ECRI has worked collaboratively with ISMP on projects not just since last year, but for decades. We knew that by combining our organizations, we would be stronger together. At last year's Cheers Award, Mike and I announced our formal affiliation. By joining together, ECRI and ISMP have created one of the largest healthcare quality and safety entities in the world, driving greater value to healthcare organizations across all care settings. We kicked off 2020 with specific goals in mind. But as you can imagine and well know, the coronavirus pandemic has made this past year anything but typical. The United States and the world have faced dire shortages of personal protective equipment for our most vulnerable frontline workers and the underserved aging care staff. Nurses and pharmacists faced new challenges in ensuring the safe delivery of patient care. So amidst that backdrop, I wanted to share the progress ECRI and ISMP have made during these past 12 months and talk about future trends in building those bridges to safety Mike just mentioned. In August 2020, we created a joint patient safety organization, one if not the largest patient safety entity in the world. ECRI alone has more than 3.5 million analyzed events, including 14,000 related to COVID, submitted by the nation's most respective health systems and providers across all care settings in our database. Bringing together the patient safety, risk, and quality expertise of ECRI and ISMP's extensive experience in determining the system-based causes of medication errors into one PSO enables our members to better address all causes of incidents, near misses, or unsafe conditions. Our aim is now on working closely together how to prevent harm, not just report it. We also issued a joint PSO deep dive on strategies for surgical patient safety. Furthermore, we developed a new joint medication safety membership program. Med safety events occur often, too often. In fact, medication errors are among most common events reported in ECRI's PSO, accounting for about 1/3 of our submitted events. Imagine that 11% of hospital medications administered result in errors. That's at least about an error per patient per day. Way too many. Our membership program includes resource centers on high alert medications, medication technologies, and medication practices. Additionally, we provide personalized support by ECRI's patient safety experts and ISMP pharmacy experts. Nobody else can do that. And ECRI and ISMP collaborated on COVID-19 resources with medication safety webinars and guidance on COVID-19 medications and medication safety risks, which we made available for free to all. So what are the future trends beyond the pandemic in healthcare, and how do we build those bridges to safety? The biggest change in the evolution of healthcare is the point of care delivery. Care is rapidly moving out of hospitals and into ambulatory settings and even homes. The COVID-19 pandemic has only accelerated the seismic shift. The rapid adoption of telehealth and remote care during the pandemic is going to continue to progress. Treatments and procedures that used to take place in hospitals with overnight stays are now often in and out procedures at ambulatory care centers. More and more patients receive complex treatments at home, such as chemotherapy infusion, dialysis, cardiac monitoring. In most cases, these devices have alarms to alert personnel when something is wrong. But when these complex technologies are used in the home setting, patient safety can be at risk. They were initially not developed for the home. Additionally, treatments becoming more complex and with new drugs and device combination therapies. That's one reason why we joined our forces with ISMP. We can closely monitor an evolving set of issues that could lead to errors and patient harm. For example, rather than oversight by a trained clinician, devices and drugs used in the home are now in the hand of an aging lay population who bring new risk to the use of that unfamiliar technology. Day in, day out, ECRI studies what can go wrong with the use of medical devices and pharmaceuticals. This new migration of technology is a game changer for the healthcare industry, the patients, and overall safety. ECRI, ISMP, the medical device and pharma industry, all healthcare professionals have to adjust to this change and need to make changes too, and how we think about delivering care and what the implications for safety are. Patient safety is non-negotiable for us. We believe, together with all of you, we can and will build bridges to safety and eventually get to a zero harm achievement. Thank you for your time. Thank you for all you do for the patients out there. And I look forward to hearing more about tonight's winners of medication safety initiatives. Thank you.
Okay, we'd now like to begin the awards presentation part of the evening. Now, each of the individuals and organizations we're honoring are helping to build bridges to better safety. And they come from a wide range of backgrounds, from the federal government to an underserved rural setting. The dedication and innovation they have shown gives us all incredible role models to follow in creating our own paths. So let's begin. And our first winner is Mary Burkhart. She's receiving a volunteer award. And I have to tell you, at ISMP, we truly consider Mary to be part of our family. It's gotten to the point that we can't even count the number of projects that she's assisted us with over the years. And not only has she helped ISMP further its mission, she is out there helping to shape the careers of countless new practitioners, introducing them to human factors principles or failure mode and effects analysis, and providing them with the tools they need to become leaders themselves. Mary, I offer our heartfelt thanks for your tireless support.
Mary Burkhart is being honored with a volunteer award for her decades of altruistic service to ISMP. She has participated in many ISMP programs, projects, and advisory groups, and contributed indispensable suggestions and recommendations. Mary authored 2 chapters in ISMP's 2006 book, Medication Errors, and has worked on the development, pilot testing, and use of ISMP's medication safety self-assessments. She also has mentored ISMP fellows as well as other practitioners just starting out in their careers, and is often called upon for advice or questions. Mary has been dedicated to keeping the lines of communication open with ISMP, often taking the initiative to reach out and share knowledge. She has been a valuable asset in helping ISMP achieve its mission.
I was very surprised when Mike called me. I had no idea I was in the running for this award, and no one has fessed up to nominating me. I'd like to thank ISMP and its staff for years of technical and moral support. They have helped me navigate through many difficult situations in the days when making safety decisions were a pretty lonely place. I have been following ISMP since pharmacy school, when I started reading Mike and Neil's column on medication errors in the journal Nursing, 1970 something, before the formation of ISMP as a safety organization. I would like to dedicate the award to my best mentor, my mom, Patricia Burkhardt, who encouraged my professional aspirations and fearlessly challenged the status quo as a nursery nurse. I had learned about the toxicity of benzyl alcohol for infants very early in my career. I shared this safety information and she pushed and pushed to get the product banned in her workplace at the newborn nursery in the hospital where she worked and went to nursing school, president of her class in 1942. We were able to change the system back then, and I have been at it ever since. I wish all of you such a mentor in your life. Thanks to my colleagues in the Medication Safety Officers Society for every bit of help and encouragement. To both ISMP and ISMP Canada, thanks for the opportunity to serve patients and see the world.
Our next award recipient is the Choctaw Nation Health Services Authority, which is receiving a Cheers Award for their incorporation of a full-time medication safety officer position in a rural health setting. The Choctaw Nation Health Services Authority is truly a unique practice setting, and they showcase how organizations can make significant bridges to safety regardless of their size. We're proud to be honoring them tonight.
Choctaw Nation Health Services Authority. The Choctaw Nation Health Services Authority, CNHSA, is receiving a Cheers Award for employing a full-time medication safety officer in a unique practice setting, which has enabled the implementation of a wide range of effective medication safety initiatives. CNHSA is located in rural southeastern Oklahoma. After ISMP published a white paper in 2018 encouraging all healthcare organizations to establish a full-time medication safety position, CNHSA expanded its auxiliary position to a full-time dedicated professional to make past safety achievements more widespread and sustainable. Establishment of a full-time medication safety officer position also helped create an extensive and proactive improvement process and a medication safety program unsurpassed in other tribal health organizations. CNHSA now serves as a strong advocate for dedicating significant resources to medication safety in rural healthcare systems.
The Choctaw Nation Health Services Authority is honored to receive an ISMP Cheers Award for our efforts with our medication safety program. ISMP has greatly impacted our organization, and we continue to use your resources regularly within our program. We want to thank our healthcare administration for allowing us to expand our program and dedicate a position solely to medication safety. We also want to thank the members of our multidisciplinary medication safety work group. They consist of medical providers, pharmacists, nurses, electronic health records staff, and quality staff. We'd also like to thank our frontline employees that have been open to making changes within our processes and procedures to make our medication safety processes safer for the patients that we serve.
Our hope is that this recognition will encourage other rural health facilities to dedicate time and resources to medication safety. Devoting a full-time employee to medication safety has helped projects and initiatives have more focus and momentum within our health system. We believe that this change has made and will continue to make great impact for our tribal members that we serve in southeastern Oklahoma. We also believe that a medication safety officer position should not exist solely in large urban healthcare systems. Medication safety officers' impact is also needed within rural tribal healthcare systems to help increase quality of care and overall patient safety. Thank you again for this prestigious award. We are incredibly honored to be recognized as a 2020 ISMP Cheers recipient.
Choctaw Nation Health Services Authority.
Okay, our next Cheers Award winner is from right in our own backyard. Our office is in Horsham in Montgomery County, Pennsylvania, maybe about 10, 15 miles north of Philadelphia. And the Einstein Medical Center Montgomery, and you can probably tell by the name Montgomery in their name, is right here in Montgomery County. And they're being honored for their development of a tool that helps identify issues and reduce code blues for ventilator patients on opioids. Einstein Medical Center Montgomery is an amazing example of an organization identifying a need and then building an innovative bridge to get them where they wanted to be. They reviewed response team calls due to opioid-induced respiratory distress, conducted a year-long study on a medical surgical unit to identify a baseline and outcome goals, and they combined several existing evidence-based assessment tools to address all the known risk factors. We're happy to recognize Einstein Medical Center Montgomery tonight for the unique tool that enables nurse-driven interventions.
Einstein Medical Center Montgomery. Einstein Medical Center Montgomery is being recognized for development and implementation of a novel screening tool called the Einstein Montgomery Opioid-Induced Ventilatory Impairment Assessment, or EMOVIA. There are other screening tools available to assess issues with ventilation of patients on opioids, but the recommended actions are physician-driven. EMOVIA interventions are nurse-driven and immediate, allowing nurses to treat patients in real time and empowering them to intervene immediately based on policy and protocol. EMOVIA is the only tool that supports the use of continuous electronic monitoring, including capnography, which is considered the gold standard for managing patients at risk for opioid-induced ventilatory impairment. Implementation of EMOVIA at the medical center has helped code blues for medical surgical patients receiving opioids remain at 0 and reduced unplanned intubations by 55% in the same patient population. The organization has shared its processes and lessons learned with the healthcare community at the regional, state, and national levels.
Hi, my name is Marie Mao. I'm the Assistant Vice President here at Einstein Medical Center Montgomery for nursing and nursing education. I'm very excited to accept this award on behalf of this fabulous team for the great work that they've done. They've had great clinical outcomes for the patients, medical surgical patients receiving opioids. Two great outcomes that should be recognized are that they've been able to maintain code blues for this patient population at a rate of 0, and they've decreased unplanned intubations for the same population of patients by 55%. They've done this and they've expanded. Their work was not over just when they got these great patient outcomes. They developed an assessment tool that is totally nurse-driven called EMOVIA, Einstein Montgomery Opioid-Induced Ventilatory Impairment Assessment. This tool is a tool that is totally nurse-driven. It's a nurse assessment tool, and it allows the nurses to do the assessment and bring the care to the patient in a much more timely manner. The other fantastic thing about this tool and this new protocol is that it puts autonomy in the nurses' hands, and any time that the nurses can be in charge of their own practice and drive their practice is a fantastic thing. So I thank you for recognizing the team. They've worked hard, and thank you.
HCA West Florida Division is being honored tonight with a Cheers Subscriber Award. Our newsletters are one of the main ways that we accomplish our mission, and HCA West Florida has done an outstanding job of using ISMP publications and guidelines and other tools to help improve safety across the entire organization. Our goal at ISMP is to provide specific practical advice on how to improve medication safety. And HCA stands out for how they've used almost all of the guidance and recommendations that we've provided over the years to enhance their culture of safety, and we greatly appreciate that. We encourage organizations to pass on our newsletter among staff, and HCA has worked hard to ensure that the lessons published by ISMP are accessible to their practitioners.
HCA West Florida Division. The HCA West Florida Division is receiving a subscriber award for consistent distribution and use of information provided in ISMP newsletters, and the resulting improvements in medication safety across their 15 hospitals. The division's Interdisciplinary Medication Safety Committee has been instrumental in implementing key safety strategies from the ISMP Acute Care Newsletter Action Agenda, as well as ISMP guidelines and assessment tools. Currently, the ISMP Targeted Medication Safety Best Practices for Hospitals are being used as a guide to perform medication safety audits and medication safety rounds in nursing units within each facility to identify vulnerable areas. In addition, promethazine has been removed from the formulary in all facilities per ISMP's recommendation. Order sets and policies have been standardized, and a quarterly system-wide newsletter has been created to communicate important information and progress in medication safety improvement to staff.
On behalf of the West Florida Division Medication Safety Committee, I am honored to accept the ISMP Subscribers Award. In West Florida Division, safety is our #1 care standard and is at the heart of everything we do. Ensuring that we keep our patients safe from medication errors and harm is the primary focus of our committee. I would like to thank all of the committee members that work tirelessly to ensure our success. But I would be remiss if I didn't also thank all of the leaders and the frontline staff within our facilities, as they are instrumental in driving the changes at the local level. Without their support and commitment to safety, our committee efforts would be fruitless. Our multidisciplinary committee is comprised of physicians, pharmacists, nurses, informaticists, patient safety, quality, laboratory, and education. Each member brings a different perspective and point of view to the safety concerns that we discuss. We are committed to working collaboratively to identify risks within the medication use process, develop mitigation strategies, collect and report safety data, create a just culture within our organization, seek best practices from internal and external organizations, as well as share our successes, opportunities, and failures. We share our knowledge by creating medication safety alerts to bring attention to a safety concern, as well as the actions to be taken. We also share by publishing a quarterly newsletter within the division. As the leading organization for medication safety, the tools and resources provided by ISMP is integral to our success. We utilize the ISMP newsletters, advisories, groups, webinars, and other resources to successfully align our goals with ISMP best practices and recommendations. For the last year and a half, we share success in bringing medication safety to the forefront of all the staff involved in the medication use process. We look forward to continuing to improve our safety strategies and share our knowledge within the 15 hospitals that comprise West Florida Division of HCA. Once again, we are humbled and honored to receive this award. Thank you.
Now, our next Cheers Award winner, Tina Seuss, she served as our go-to person for insight into safety issues related to infusion technology. She's helped shape ISMP's thinking and recommendations, as well as infusion technology implementation for many other healthcare organizations. We're really proud to honor Tina tonight, as she is an outstanding role model for using a patient-centric approach to infusion-related safety technology. Her work has helped Lancaster General Hospital in Pennsylvania win 2 ASHP Best Practice Awards and an ISMP Cheers Award. Tina also has been dedicated to sharing her safety knowledge widely, frequently speaking at national, state, and local conferences and educational programs. Thank you, Tina, for your vision and leadership in this area.
Tina Seuss is receiving a Cheers Award for her exceptional leadership in the healthcare information technology industry on a national level, as well as in her own community hospital. Over her career, Tina has become known as a forward-thinking expert on several medication use technologies, including barcoding access across the entire medication use process and smart pump electronic health record interoperability. She has participated in alpha and beta testing for emerging technologies, conducted research, and shared her knowledge through numerous presentations and journal publications. Tina also has provided ISMP with input on the challenges and achievements possible with medication-related technologies, using her unique perspective on technology adaptation in a real-life setting.
Hello, everyone. I would like to thank ISMP for honoring me with the 2020 Cheers Award for efforts in promoting infusion safety through Smart Pump EHR integration. Infusion safety is one of my passions, and I need to thank the Penn Medicine Lancaster General Health leadership for allowing me to focus on adoption and utilization of medication safety technology. I have great mentors at LGH who support me and allow me to pursue development opportunities to continue to learn and improve the infusion safety platform. I also need to thank the Smart Pump and EHR vendors for listening and evolving their technology solutions to eliminate the human variability in the administration of IV medications. And to the folks at ISMP who have long been a champion of infusion safety, thank you for helping provide a platform for the important message in how technology can improve infusion safety. I would like to congratulate my other award winners. Thank you again, and stay well.
The George D. Demizio Award was established in memory of an ISMP trustee and honors safety advocates within the pharmaceutical industry. The first D. Demizio Award was given in 2012, and it's only been presented 4 times before. We're proud to introduce Mary Baker as our 5th winner, and Mary would remember George. We interacted at different meetings, and I'm sure Mary is very fond of that memory. Mary's been an invaluable resource for ISMP in understanding the industry side of pharmaceuticals. She's known not only for her expertise in medication safety, but also for her openness, objectivity, and honesty in responding to safety-related issues. We can call her anytime and get industry inside information. And Mary, we're excited to be honoring you tonight and appreciate all you've done to help advance medication safety. And I didn't even mention that you're also on the USP Expert Committee on Nomenclature and Labeling, and you've been working on that committee for many years, and I have the pleasure of working with you on that, and a lot has been accomplished thanks to your input.
The George D. Demizio Award was established in 2012 in memory of a late ISMP board member who advocated for greater cooperation between the medical industry and the broader healthcare community to promote safer drug products. The award is being given this year to Dr. Mary Baker for consistently serving as a resource for ISMP regarding pharmaceutical product manufacturing. Dr. Baker has more than 30 years of experience in the industry and is currently the Senior Director for Sterile Injectables in Pfizer's Biopharmaceuticals Group. She has provided ISMP with essential insight from the industry side and helped gather information and direct ISMP to credible sources for topics outside of her area of expertise. Dr. Baker has served as Vice Chair of the USP Nomenclature and Labeling Expert Committee and holds an adjunct faculty appointment at Purdue University College of Pharmacy. She has received numerous honors throughout her career, including USP's Award of Recognition, Purdue College of Pharmacy Distinguished Alumna Award, and the Purdue Pharmacy Women's Leadership Award.
I would like to express my gratitude and thanks to ISMP and the Board of Trustees for this honor. As part of Abbott, I first met Mike Cohen over 25 years ago near O'Hare to discuss a labeling issue, and it's been a wonderful collaboration ever since. Thank you to my colleagues throughout the years at Abbott, Hospira, and Pfizer for their support. And thanks also to healthcare professionals we've interacted with, especially during this difficult time. I look forward to further productive collaboration with ISMP in the years to come. Thank you.
And now it's time for ISMP's Lifetime Achievement Award. This is given in memory of our late trustee, David Vogel. David was a trustee in the early years of ISMP. And it honors individuals who've made a lasting difference to patient safety. We're extremely proud to introduce this year's winner, Dr. David Cousins. Many pharmacists just start out in their careers today may not be aware of just how influential David has been in terms of the way they practice. He's been instrumental in shaping the field of our reporting and medication safety and making it an integral part of the healthcare agenda. Thank you, David, for all of your contributions to medication safety, including around the world.
ISMP's Lifetime Achievement Award honors an individual who has had a significant career history of ongoing contributions to patient safety and has had a major impact on safe medication practices. This year, the ISMP Lifetime Achievement Award is being presented to Dr. David Cousins for his ongoing work as a true pioneer in medication safety. Dr. Cousins has tirelessly pursued development of a safe medication policy agenda in the United Kingdom that has since been modeled around the world. As chief pharmacist at the Derbyshire Royal Infirmary, he played a leading role in raising awareness of medication safety issues, and together with Dr. David Upton, wrote a monthly column on medication errors in the journal Hospital Pharmacy Practice. Dr. Cousins served as head of safe medication practice at the former National Patient Safety Agency and then NHS England for 12 years, helping develop the national reporting and learning system and issue patient safety alerts. He also was a key author of the Design for Safety publication series, illustrating how good design can help minimize risk to patients arising from labeling and packaging of medicines. Dr. Cousins authored a 2014 patient safety alert requiring every NHS organization in England to appoint a medication safety officer. While working for Healthcare at Home, he designed and implemented a comprehensive safety incident reporting and learning system for the home care setting in 2017. During his retirement, Dr. Cousins has been advising and publishing reports for the patient charity Action Against Medical Accidents. He is a founding member and committee member of the International Medication Safety Network and has won many prestigious awards, including an ISMP Cheers Award in 1999 and 3 Lifetime Achievement Awards from the Royal Pharmaceutical Society, the UK Clinical Pharmacy Association, and the Guild of Hospital Pharmacists.
Well, hello from Derby, England. I'm pleased to join this year's virtual Cheers Award celebrations. This is my first opportunity to wear a jacket and a tie since March. I'm honoured to receive this ISMP Lifetime Achievement Award. Recognition from my peers is particularly pleasing, and I thought I might reflect on my time working to improve safe medication practice in England. So how did I become interested in medication errors? In the 1980s, I was a new chief hospital pharmacist in Derby and developing new services. And medication errors sometimes occurred in the hospital, but I was not informed unless it was a dispensing error. Each healthcare discipline managed their own errors, and it was more to do with disciplining staff than system improvement. There were 2 fatal errors that required me to attend the coroner's court that prompted me to question how we were managing medication errors. The first was a death due to a verbal prescription for an antibiotic for a patient with known allergy. We had poor written procedures for prescribing medicines and no training provided to junior medical staff concerning prescribing. The second was a death due to misselection of a 50 ml soluble insulin syringe infusion instead of the prescribed sodium heparin syringe infusion. We had just introduced a pharmacy IV additive service. Both types of syringes were in the ward refrigerator and they looked identical. This indeed was national policy to label and package medicines in a similar way, which was intended to force users to read the label. We even required some manufacturers to use black print on yellow background labels on a wide range of generic injectables. The coroner at the end of the case suggested that the pharmacy might like to investigate the use of colour and design to prevent further incidents of this type occurring. So my journey began. I started to research or try to research medication error information, but there was very little out there, certainly none in the UK. And then I came across publications by Mike Cohen and Neil Davis in the USA Hospital Pharmacy Journal, providing case studies and guidance. This was a revelation to me. I was fortunate soon after to meet Mike at ASHP meetings, and I've got to say he's been my role model ever since. So in the 1990s, after kind of getting this information together, I was able to set up a multidisciplinary committee in the hospital in 1991 to share and review and act on medication errors that were occurring in the hospital and trying to focus on minimizing the risk rather than just disciplining the staff involved. Interestingly, 1991 was the same year that ISMP was set up. Some of the errors that we reviewed have been published by Mike Cohen, and talking to some of the other chief pharmacists in the NHS hospitals, they too had seen some of these errors, although they hadn't been published in the UK. Together with the chief pharmacist in the other Derby hospital, David Upton, we started publishing anonymised medication error reports in the UK Hospital Pharmacy Practice Journal, using our own reports and those from newspaper cutting service that we subscribed to. We quickly identified high-risk, high-alert medicines such as potassium chloride, methotrexate, warfarin, opioids, wrong route errors associated with the universal use of IV Lure connectors, and lookalike labeling in packaging. This is the first time that these risks were really being talked about in pharmacy journals in the UK. The monthly column became very popular, and although I soon realized there was a difference in readers knowing about a risk and their organizations actually implementing controls to minimize these risks. However, some NHS senior managers and pharmacy leaders approached me and they said they took a dim view of publishing details of medication errors, as it undermined the reputation of the NHS and the pharmacy profession. In 1999, at the mid-year meeting in Orlando, Mike Cohen was not able to join the ISMP breakfast meeting for the international colleagues that he put on every year. His good excuse was that he was in the White House Rose Garden with President Clinton, publicizing the new book from the Institute of Medicine called To Err is Human. And we watched him on TV. And he was able to join us a little while later. The publication, An Organisation with a Memory, authored by Sir Liam Donaldson, the Chief Medical Officer in England, was published in 2000. And both publications highlighted the frequency of medical error and the need for greater openness and learning about errors. The NPSA in England, that is the National Patient Safety Agency, was set up in 2001 to establish the National Reporting and Learning System and issue patient safety alerts. I joined in September 2002 as head of safe medication practice, and I was pleased to write the first ever patient safety alert concerning potassium chloride concentrate injection. The NPSA was a quango. This is a quasi-autonomous, non-governmental organization, sometimes called an arm's length body. I often said that perhaps the arms were very short because there was always political and media scrutiny of this agency. It was sometimes regarded as the bad news agency, as we had to describe risks before we could describe safer practice. The media always gave greater attention to the risk than the safer practice we wished to promote. And getting things published was always difficult because you had to get a lot of sign-offs, not just within the NPSA, but within the Department of Health. Getting things done between 2000 and 2010 were the glory days. We were actually able to issue many patient safety alerts, observatory reports about incidents reported via the NRLS, and design guides. Many lookalike medicine products, usually from the same manufacturer, were responsible for medication errors, but the medicine regulator was not able to enforce design to minimize misselection and misuse of products within a manufacturer's range. And so we were able to work with the Royal College of Art and other design institutes to develop booklets illustrating safer design features for medicines, labeling and design. And working with the NHS procurement groups to award national and regional contracts on safer design, we were able to convince the manufacturers that it was in their interest to actually change their habit of having house style and actually differentiate their products and their doses. In fact, the UK became the toughest market for labelling and packaging of medicines in Europe, according to many of the manufacturers I talked to, and that we really had focused on minimising lookalike errors and miscommunication errors over dose and strength from labelling and packaging. We also were successful in introducing medical devices with non-Lura connectors. And this was many years before the international ISO standards for small bore connectors. So we had unique connectors for intrathecal and other, and also oral medicines, liquid medicines. And this was the time that we continued to link with ISMP in the USA and internationally, and other patient safety organizations dealing with medication errors. And we formed the International Medication Safety Network in 2006. And I was able to work very closely with people like David Yu and Etienne and Marie Jose and Mario, and a lot of people from around the world that were working on similar problems to the ones that we had in England. Well, we had some pushback to many of the MPSA initiatives, and I want to just focus on this because it's interesting. We were out to minimize these risks, but we had comments about too much transparency. Legal staff, particularly in the health service, were unhappy. They wanted the information about incidents to be released after coroner's court hearings, and this could be months or even years after the incident. And we said to them that this gave the NHS no opportunity to improve their systems because an incident had occurred. We also found that the PSA guidance, the patient safety alert guidance, was often criticised because it cost additional money to have safer systems. And many NHS managers said, could you write the guidance on the back of a cheque and fund everything that's necessary centrally? And another pushback was, well, we've not had the same problem here, or we've had the same problem, but the solution that you're promoting was not invented here. And so there was pushback against a top-down approach, and people saying, well, we would like a bottom-up approach. We want to develop our own solutions to these problems, which is fine if you have enough capacity to do so. But we often found that the people said who wanted the bottom-up approach often didn't actually get around to doing anything. And there was also interesting interpretation of data protection law that not only did we exclude information about patients' names and healthcare staff names and hospital names, etc., but some of the interpretation was, well, you can't even describe the incident. It could be tracked back, I don't know how, to the individual hospital, and so no incident descriptions can be given. I think this is really an extreme interpretation of data protection laws. Well, in 2010, a new coalition government was brought into the UK, and it had a wish to abolish all quangos, including the MPSA, and they wanted less top-down guidance, a more bottom-up approach. And so in 2012, the MPSA was abolished, and a very small number of staff and the National Reporting and Learning System transferred to the NHS England, an organisation that actually managed the NHS and much, much closer to government. So it was hardly surprising that, in fact, very few publications came out at this time, very few patient safety alerts, very little learning. And in fact, around this time, looking around the world, standalone patient safety organizations were far less popular internationally. And we started to look at the opportunities that a redefining of the pharmacovigilance definition of adverse events and adverse drug reactions, including now for the first time medication errors. And so we thought there was an opportunity to work much more closely with pharmacovigilance, although I have to say that the definition of an adverse event, an adverse drug reaction, still does not include errors of omission. And the number one error that we found reported to the MPSA was omitted and delayed dose. So those could not be handled by pharmacovigilance. In 2014, with this closer collaboration with pharmacovigilance, it was possible to work with my medical regulators, the MHRA, and we issued a patient safety alert, my last, advocating the importance of having medication safety officers and medical device safety officers in every NHS organisation. So I retired from the NHS in 2014 after nearly 40 years of service, and I joined Healthcare at Home, a home care company, to develop a new patient safety incident reporting system that recognised that one incident could be classified by one or more reporting category. It could be a patient safety incident, as well as an adverse event, as well as identifying a faulty product. It might also include some safeguarding issues relating to vulnerable patients and some data protection issues. And all this needed to be managed internally and reported to one or more external organizations. And so this is the first time where a fully comprehensive reporting system had been developed for the home care sector in the UK. And interestingly, analysing the incidents, again, the number one patient safety issue for medicines was omitted and delayed doses of important medicines for chronic conditions due to late prescriptions from the NHS. And so, full circle, for the last few years, I have been advising a UK charity called Actions Against Medical Accidents. And in 2020, I was able to publish with this organisation a report called An Organisation Losing Its Memory. So in England in 2020, it is no longer possible to read published details of individual incident reports. The National Reporting and Learning Service reports the total number of incidents by category. So you can find out the total number of medication incidents that has been reported and their clinical outcome, but no other detail is published. So no understanding of what is causing the harm other than it's a medication incident. And the number of published patient safety alerts has reduced dramatically and only focus on new and unknown risks. So there's no information about incident reports received involving previously published risks and no updated guidance on those risks. And the previous MPSA alerts have been archived. So these risks concerning opioids and anticoagulants and ones that even potassium, we really don't know anything about because that information is no longer available. The main thrust from NHS Improvement, which is the organisation that takes patient safety forward now, is a national curriculum to teach every member of the NHS patient safety science to promote individualised local actions to risks. But it doesn't take on board that there's always going to be limited local capacity to develop patient safety improvements, and it may lead to duplication of effort, and there are concerns over postcode patient safety. So in conclusion, the work of ISMP, the International Medication Safety Network, national centres for patient safety involving medicines, continues to be vitally important. There have been some significant improvements in reporting medication safe practices over the years, but in recent years there have been some reductions in reporting and learning and openness and transparency and identified improvements have not always been maintained. I've really enjoyed working on this topic, talking with patients and their families and staff involved in serious medication errors and how systems have been changed from the learning obtained from incidents has been a particularly rewarding activity. This work needs to be continued, and I wish all of you working on this topic every success in the future. And finally, some thank yous. Of course, to my role model, Mike Cohen. I couldn't have done it without you, Mike. To my colleague of many years, David Yu, who now is General Secretary of the International Medication Safety Network. All my colleagues in the other international ISMP centers and other medication safety organizations throughout the world, the medication safety officers in the NHS, the pharmacy staff in Derby, and last of all, but really the most important, the support I've received from my wife and family. I thank you all. It's worthwhile to continue, and as I say, I wish you every success in the future. Thank you.
Okay, before we conclude, I have a few people to thank. First of all, the ISMP staff. What a year. And no one just up and quit. Amazing. Second, all our new friends at ECRI. Thanks so much for making the affiliation a success. And also, we're grateful for everyone who helped make our first virtual Cheers Award a success. Janice gave staff a shout out earlier in the evening, but I'd like to add my own special thanks to Jordan Rufo, Lisa Shiroff, Jen Gold, and Renee Brio. All of you worked so hard to pull all this off, making Rachel's life a lot easier this year. So thank you guys. And finally, we'd like to again point out that none of this would be possible without our generous supporters and contributors. And that's you. Our sincere thanks go out to all those organizations and individuals who've given us their trust and support and truly helped make a difference. You're why it's possible for us to honor these safety leaders and heroes who are building bridges to a better future. Okay, we're now going to end with some additional networking time so you can connect with colleagues or meet new individuals you didn't have a chance to touch base with earlier. And if you haven't visited the ISMP booth, please stop by and let us know what you thought about tonight's evening. And if you haven't entered our raffle yet, it's not too late. Click on the link in the event info box on the right-hand side of the Brella event home screen. Tickets are available until midnight tonight, by the way, and we'll announce the winners through Facebook live stream tomorrow at 12 p.m. Eastern time. I think I'm going to be doing that, as a matter of fact. Enjoy the rest of your evening, everyone, and thanks.